Hi everyone, welcome back. I'm Dr. Bisma, and in this video, I'll walk you step by step through a systematic thyroid examination. This is the exact structure you can use in OSCEs and in real-life clinical practice. Let's get started. I begin with the hands. I look for warm, moist palms and fine tremor. Both suggest hyperthyroidism. To bring out a tremor, ask the patient to stretch their arms and balance a piece of paper on top. I also check for palmar erythema, onycholysis, and very rarely, thyroid acropachy. Next, I check the pulse. Tachycardia or atrial fibrillation suggests thyrotoxicosis. Bradycardia points towards hypothyroidism. Now, I move to the eyes. In hypothyroidism, you may see periorbital puffiness or loss of the outer third of the eyebrows. In hyperthyroidism, especially Graves' disease, I look for exophthalmos, lid retraction, and lid lag. To test lid lag, I ask the patient to follow my finger downwards. If the eyelid doesn't keep pace with the globe, that's positive. I then check eye movements in all directions. Graves' disease can affect the extraocular muscles, leading to restricted movement, sometimes mimicking an oculomotor cranial nerve palsy, especially impaired upward gaze. Now I inspect the neck. From the front and side, I look for visible swellings, asymmetry, scars, or dilated veins. If there's a swelling, I ask the patient to swallow. Thyroid swellings rise with deglutition. Standing behind the patient, I palpate each lobe of the thyroid and the isthmus while the patient swallows. I assess size, consistency, nodularity, tenderness, and mobility. If I feel a solitary nodule, I note whether it is smooth, irregular, or hard. Finally, I auscultate the gland. A bruit suggests increased vascularity, as seen in Graves' disease. Next, I examine the shins for pretibial myxedema, thickened, indurated skin, a rare but specific feature of Graves' disease. To complete the examination, I check reflexes. In hyperthyroidism, they're brisk. In hypothyroidism, the relaxation phase is delayed, the so-called hung-up reflex. And that's a systematic thyroid examination. Hands, pulse, eyes including eye movements, neck, pretibial myxedema, and reflexes. Always go in this sequence to stay structured and exam ready. If you found this video helpful, hit like, subscribe, and share it with your friends who are preparing for exams. See you in the next one.